It could be a brand new weapon against the coronavirus. Drug maker Merck is asking the FDA to authorize the first pill to fight COVID-19. And for healthcare professionals, it could not come soon enough.
As long as it's effective, I think that will shorten the amount of hospital stays.
Merck says its COVID pill cuts hospitalizations and deaths in half. Now, the FDA needs to verify those claims as part of the approval process. Samantha Schenk is a registered nurse who's been dealing with COVID patients since the beginning of the pandemic. She says not only could this new treatment help reduce the number of hospitalizations, but it would also save money.
Patients won't have to have the medication given to them while they're in the hospital, which will reduce the amount of time and money that it costs to have these patients inpatient. And it also reduces the workload of the healthcare professionals because the patients can be treated outpatient now.
Right now, there are only 3 FDA-approved antibody drugs. And even though they are highly effective, they're also expensive and can only be administered through an IV or injection.
We are using all of our resources now. I mean, you hear about people, constantly being short-staffed. And that's also due because they're taking on the workload of having these types of patients that don't necessarily need to be treated in the hospital.
If the FDA approves the new COVID pill, the U.S. government has already said it will buy enough of it to treat more than 1.5 million people. But now health experts fear that this could be yet another reason for unvaccinated Americans to remain unvaccinated.
Am I going to then take the time to go to the hospital to then say, oh, I have COVID, can I get a pill? If I'm already a, let's say, quote-unquote, anti-vaxxer.
I see people that don't want to get vaccinated, so maybe they want to get a pill.
Either way, Schenk says prevention is still more effective and less expensive than treatment. Her recommendation? Get vaccinated.